We're going to be seeing big tech coming out with more of these devices with more features on them. So it's a way to get people to buy more wearables, as we call them. On the other hand, they're also getting much more sophisticated every year with biosensors and smart patches and so on.
Hey gang, it's Thursday, November 18th. Lisa and listeners, welcome to the Behind the Numbers Daily, an eMarketer podcast made possible by Tenuity. I'm Marcus, and today I'm joined by our principal analyst covering digital health. It's Lisa Phillips.
Hi Marcus, thanks for having me.
Hey Lisa, thanks for hanging out. Today's fact, elephants are pregnant for between a year and a half to 2 years.
I got no comment on that.
That's the longest amount of time. It's literally the longest amount of time. Elephant pregnancy is the longest out of any mammal. Elephants. I feel for you, man. I don't even... Let's just get on with the show. Remote patient monitoring is what we're talking about. Oh my goodness. Talking all about remote patient monitoring today. What the hell is that? Well, we'll start by explaining it. We're going to talk a lot about it, why people are using it, who's using it, how many folks there are using it, what kind of use cases there are, what's pushing it forward, what's holding it back, and what's next. But first of all, what is it? What are we talking about? What is remote patient monitoring, or RPM? We're going to abbreviate it to for the sake of this episode. But Lisa, what is it, and why should listeners be paying attention to this topic?
Well, it's a couple of things. It's been around for a long time. A lot of people know it as their Fitbit or their Apple Watch or a Google or Samsung Watch. Amazon Halo is out there now. All of those devices are recording in some way, some biometric, whether it's blood pressure or heart rate or in some cases blood oxygen level. All of these big tech manufacturers are trying to get to doing blood sugar measurements at some point in the future.
Wow.
But it's
remarkable how many of them, sorry to interrupt, It's remarkable how many things that these devices can track. I mean, if you don't pay attention to these devices, if you're not a user of, some kind of a smartwatch, then maybe you kind of tune out and you don't really follow all the different things that they're adding. And maybe there was a version 1 and now there's a version 4 and what's the difference? But you have a really good chart in one of our recent health reports covering remote patient monitoring that was looking at Apple Watch Series 7, the Samsung Galaxy Watch 4, the Fitbit Sense, the Amazon Halo, to varying degrees, obviously. They don't cover all of these, but the Samsung Galaxy Watch 4 nearly covers all of these, but they check pulse, EKG, blood oxygen, blood pressure, stress levels, skin temperature, there's fall detection, sleep tracking, and body composition, all from this watch. It's remarkable.
Yes, it is. And this was all brought on by the pandemic, or a lot of it was brought on by the pandemic, that people suddenly realized, blood oxygen level is important. Maybe I should track it, for COVID in case mine starts dropping.
And a surprising number of people are willing to share
these
metrics with the doctor. Yeah, Civis Analytics, again from the report that we have on this. Blood pressure, 71% of people are willing to share that. Weight, 68, heart rate, 65, blood oxygen, 57, sleep, 57, 56%, stress levels. So people are, it's tracking this stuff, but people are quite willing to give this data to their doctor, which maybe is fair. I mean, if there's going to be someone that you trust, it's probably your doctor.
Yes,
I would hope.
Doctors are the most trusted in the healthcare system. Not as many people want to share this information with their health insurance company,
their friends and family,
or their employers.
Yes.
Now, I was going to say there's another set of devices that are really much more medically credible, as in, internet-connected blood pressure cuffs, internet-connected weight scales, and devices like that help patients with congestive heart failure, diabetes, and so on, constantly send information to their clinician's office. Sometimes it can go straight into their electronic health record. And in that way, doctors and clinicians can look at this data and say, this person hasn't been moving around a lot this week. We need to get over, someone needs to contact them, or, maybe they get contacted twice a week. I mean, just to digress, smart speakers are another form of, conversational AI, artificial intelligence, can check in on people, ask, are you doing okay? Do you need more medication? That kind of thing. So
So to summarize, we've got smartwatches, we've got these, as you mentioned, internet-connected versions of medical devices, voice technology, connected clothing, biosensors, all sorts. I want to talk about the idea of the tracked versus the shared data. So there are certain metrics that people are willing to have tracked. Deloitte from June 2021, what health and fitness metrics do US wearable users track with their wearable devices? Most people, it's steps, 59%, maybe unsurprisingly. Then workouts, 42%, heart health, 37%, sleep quality, 35%, and so on and so forth. But in terms of what people are willing to share, and you mentioned some of these devices sharing data with their doctor, Health Union had some numbers from January of 2021 and looking at the sharing of device health data with different healthcare providers, according to American patients. The heart rate monitor or pacemaker, over 75% of people willing to share that data. The device automatically shares that data with their health professionals, whereas something like a fitness or a wellness wearable, a Fitbit, a Garmin, etc., most of that data, 72%, is not shared. And so I'm wondering what your thoughts are on the relationship between tracking this stuff and people's willingness to share this information, dependent on the device, it would seem, to a certain extent.
On the device, but also just the reason why someone is wearing a Fitbit or why someone is wearing, an Apple Watch. It's what we call this movement, the quantified self. And it is about the self. I want to know about me. Am I sleeping okay? Frankly, I know if I'm sleeping well or not.
Right.
Pretty much know when you wake up in the morning. But I've read articles where people say, oh, I'm a distracted sleeper, and I didn't know that till I wore this watch to bed, or anyway.
So it's more about knowing, like, I'm wearing this because I want to know, as opposed to I'm being prescribed this by my doctor because they want to know because of a certain reason.
Exactly.
Got it.
This is more about ego for some people. Yes, how many steps did I beat my sister? Did I do better than my spouse? Things like that. Games that people can play. But on the other hand, there is, with the Amazon Halo, that you can take a picture of yourself, scan your body, and it will upload to Amazon Cloud and, tell you your BMI and all kinds of information, and then start encouraging you to do this, that, or the other thing.
So what's the reason for this? You have a few reasons in the report, but if you had to kind of whittle it down, what is the reason for RPM?
Well, on the consumer side, like I said, it's quantified self. I want to know if I'm okay. From a medical, clinician's perspective, it's how can we track this person's, biometrics and keep them well, keep them out of the hospital, keep them from having to visit a doctor, go to the emergency room. And a lot of now we're getting to the point where we have hospital at home programs that are being paid for by the federal government through Medicare and so on, that a lot of healthcare providers are jumping on this bandwagon because now they're getting reimbursed for it. But it's really, maybe you stay in the hospital for a certain event or surgery or something, but then they send you home almost, sooner than they would have. But you take a smart tablet, you maybe have a connected scale, you maybe have different things, plus a home health worker will come and visit, work with you, maybe you get rehab there. So it's really cutting down on patient days.
Right. You don't need to be in the hospital if you can be monitored remotely. So as you mentioned, reducing hospitalizations, in the report, expanding access to care as well, and also helping just with from the very early stages of triage as well as that. How many Americans are using remote patient monitoring? We have some forecast, Lisa. We've got 39 million Americans using it today. We're expecting that figure to sort of double, nearly double by 2025 to 71 million as a share of the population. That's 15% of Americans using remote patient monitoring today, and that is once a month. They're using the device once a month at least, 15%, 26% by 2025. What do you make of these numbers?
Again, it's partially pandemic driven, and I'd say a lot of it is the Gen Z and millennials who are very digitally oriented anyway. If you can quantify something on, from your wrist to your phone, we're going to be seeing big tech coming out with more of these devices with more features on them. So it's a way to get people to buy more wearables, as we call them. On the other hand, they're also getting much more sophisticated every year with biosensors and smart patches and so on that are going to be used. They were looking at the senior population. And insurers really want to keep these people out of the hospital if possible. So I think there's going to be a lot more of this being prescribed and being used for the senior population.
Do you see a device category emerging? Is it most of it going to be smartwatches? Is it going to be internet-connected devices that are sent home, like pacemakers, things like that? Is it going to be a new category? What do you think is the most interesting category to watch in terms of RPM?
That's a hard one for me. I would say, just from a consumer standpoint, I'd say Apple is trying to get its AirPods certified as hearing aids or hearables, which would, not that you'd be monitored through those perhaps, but just the fact that big tech is trying to really keep this going and up the game.
Mm-hmm. So 35% of US hospitals, the report notes, and clinics said in 5 years, RPM will surpass inpatient monitoring in usage. Will surpass inpatient monitoring in usage. That 45% expect to see about the same usage, as according to Vivalink from February 2021. Also from that study, 1 in 5 hospitals, US clinics reported using RPM technology. A further 23% plan to adopt within a year. Let's take a quick break for a word from our sponsor, and then we'll be right back with the rest of the episode. Media is no longer a mass reach vehicle. Fragmentation is an understatement. Media is now about connecting with people in a personalized way, in a way that reflects their data privacy. Rethink Media, rethink performance with Tenuity, the largest independent performance marketing firm across streaming TV and the triopoly of Google, Facebook, and Amazon. Find out how at rethinkperformance.com. All right, folks, we are back talking all things remote patient monitoring. We've talked, Lisa, a bit about the reasons why this is being propelled forward. We talked about the quantified self and the movement entering the mainstream. Also in the report, 2 other notes, new reimbursement guidelines from the government and also telemedicine. Talk to us about those 2 elements.
Well, reimbursement is key for anyone any provider or insurer to get paid for it. If there's no carrot, no amount of sticks is going to really going to get people to use this. But for telemedicine, it complements remote patient monitoring devices and usage completely, because it means you don't have to have a doctor's visit. Someone can check in with you on a smartphone or a tablet. And we see the telemedicine. And I'm not talking about telehealth. This is telemedicine, which is a real call between a clinician and a patient. It's not just somebody calling up to make an appointment or reschedule something. So telemedicine is what is spurring the whole remote patient monitoring movement, because you can have someone remotely still in contact with a patient or the patient's caregiver.
Okay, so does telemedicine, does that count as remote patient monitoring?
No.
Is it a subset of, where does it live?
We look at that separately. It's a whole, like I say, it could just be people using text messages or phone calls back and forth with their doctor.
Because we have more people doing that this year. So what do we have? 76 million Americans involved with telemedicine today, growing to over 100 million by 2025. But still, it's fueling this RPM trend among healthcare professionals in the UK and the US. Rainer Hollander, former Insider Intelligence analyst who wrote this report, notes 70% named connected medical devices, one of the technologies that will have the biggest impact on healthcare in the next 5 years, according to a May 2021 survey by Hewlett-Packard Enterprise. That 70% was more than said telehealth will have an impact or a bigger impact, or electronic health records as well. Lisa, what's holding it back? What's holding RPM back?
I would say from a medical standpoint, it's people who decide, I'm not going to do this. I'm not getting on that scale. I'm done with this. I'm fine. I don't need this anymore. And so it's like mobile health apps.
And why would that be? Is that, sorry to interrupt, is that because they're nervous about the cost of having to continue to be monitored by the healthcare professional, because everything seems to cost something with the US healthcare system? Is it that they don't like the idea of continuing to be tracked? What do you think the resistance is down to?
Well, I really don't see an awful lot of resistance, and that's why I'm saying I think it's only going to be we didn't figure cost into this because it's mostly the providers who are getting reimbursed and prescribing some of these devices, which these people, a lot of patients would get in the hospital, like a smart patch that will automatically send, heartbeats per minute every few hours to through an internet connection to a hospital or a doctor's office. Those kind of passive devices probably will be well accepted. It's ones that are a little more invasive or take a little bit more time. I was going to say there's a lot of people who, they'll download an app, use it for a week or two, and then say, I'm done. That's it. And then they go back to their doctor, and the doctor says, what happened? And they're like, I didn't feel like doing it. So, you can't make people do what they don't. One thing that is driving it, though, I will say, we didn't talk about, is pharmaceutical companies are using these the clinically oriented sensors in their drug trials, their clinical research trials that they use for getting drugs through the system. And the pandemic practically shut that down. So when they found that they could use a lot of these sensors, they're thrilled. These are now called decentralized clinical trials, where the FDA will accept certain amount of data coming from these sensors from people who don't have to go to a hospital. They used to have to go to a real facility and be monitored for 6 weeks at a time or something. And it was so hard to get people to sign up for these trials in a lot of cases. And now it's gotten a lot easier. So there's one advantage.
So going back to the things holding it back for a second, internet access was something that was pointed out in the report. I thought it was interesting. And that might seem a little bit strange in a developed country like the US, but we do have 12% of the population, over 30 million Americans who don't have internet access for one reason or another, whether they're older and they don't care to need it, whether they live in remote parts of the country, maybe they can't afford it. Over 30 million Americans don't have access to the internet. And when you look at older folks, baby boomers, 20% of those folks don't. So it over-indexes quite drastically the older you get. And then the second thing was 2019 recent study conducted by OpenSignal showed that over 10% of Americans still exclusively use 3G. So even if you're thinking, oh, well, maybe they'll just, use it on their smartphone. No, not so much. There's still a fair amount of folks using 3G, although it was recently mentioned that the US is going to be shutting down the 3G networks to make more bandwidth available for the rollout of 5G, but that's still not happened quite yet.
My husband will have a hard time with that because he uses TrackPhone.
Oh, is he one of the people?
Yeah, he's one of those people who would have a problem with this remote patient monitoring.
Okay. Well, it seems like he's not alone. There are millions of people out there who would have a problem with it. What's the share of people who are, being sent home with these devices and it's just part of their life forever and ever now versus I'm treating a specific case as a doctor and I want you to wear this thing for a set period of time? Do we have any idea of the balance between the two?
I have not seen data on that, no.
Okay. Because, being asked to monitor something for a condition you have that is treatable is one thing. Being asked, this is now part of your new life, could be much more difficult to stomach if you have to use that thing for the rest of your life, especially if you haven't decided to use it yourself, like something like a smartwatch, if it's been prescribed for you. Lisa, what's the next step for remote patient monitoring? We could look way into the future, 2025, double the amount of people are going to be using this as do today. But in terms of next year, the start of next year, where does this go next?
Next, I'd say it has to really become much more embedded in people's electronic health records. Doctors aren't going to look at somebody's, you don't go to your doctor and say, here, look at my smartwatch and see what how I exercised this week. I mean, that's not clinically viable data. What they need is, in order to make this really work, it has to be connected to, a place where physicians can actually look at the data easily. Mm-hmm. I would say, let's see, healthcare payers, it's the insurance companies. They really have to, they already see early data that shows them that this is going to keep people probably healthier, which is where we're going as a healthcare system, really putting a lot more emphasis on primary care and watching people's vitals that way to keep them from, deteriorating.
Right.
So healthcare, insurers need to be proactive about partnering with some of these firms. And I'm talking about big tech. I think they probably already have, Google, Fitbit, even Peloton has some partnership with an insurance company. But again, it's up to whether people are actually going to get on the bike and use it.
Right. Right. Well, that's what we've got time for this episode. It's time now for the post-game report. So Lisa, in this part, I'll ask you for 2 quick takeaways from the show, if you could.
Well, I think we're going to see a lot more remote patient monitoring helping with drug discovery. That's where I see a lot of big uptake. It's not really talked about a lot, but it's hard to get people into these trials and keep them there. So this could help that. Also, I think it really will bring down some healthcare costs along the way. And that's what everybody's betting on. Unfortunately, it's going to change the way hospitals operate. They count on having heads in beds for their revenue, sending people home. But this is where they have to have the program downstream. If it's connected to their system, they still get the revenue through value-based care and whatever, all kinds of different payer partnerships and agreements. But that said, I think remote patient monitoring is here to stay.
The report is called US Remote Patient Monitoring Forecast 2021, What's Driving Growth and What It Means for Healthcare. If you're a pro subscriber, you can check that out. Lisa edited and peer-reviewed it. That's what we've got time for today's episode. Lisa, thanks for hanging out.
Thanks for having me, Marcus. Good to see you again.
Of course, yeah, you too. Thank you to Victoria. She edits the show. Thanks to everyone listening in. We'll see you tomorrow for the Behind the Numbers Weekly Listen, an eMarketer podcast made possible by Tenuity.